So I think it goes beyond the technical. I think it's important not to suggest that it's only relational. I mean, it needs to work.
Yeah.
So if the digital solution lets you down, nobody's going to do it. If the posters aren't up and the postcards aren't in the appointment letters or whatever system you want to use, if that has to be excellent. The graphics have to be good. The system has to be reliable. The phone number you phone to tell somebody you need training has to work. But at its core, I think what James and his colleague invented was a way of creating relationship between a provider, whatever that provider is. It might be a social care home, it might be a dental surgery, it might be a GP practice, with a user. I don't really like that word, but the patients, the families and the carers who we serve. And we've all got those relationships. Some of them are more anonymous than others. So it can, a radiology service can be quite anonymous. So going for your CT scan, perhaps for the only time in your life, can be a very, very anonymous experience. And you might be there for 2 hours. You might never know anybody's name. You might have a horrible experience, or you might have a joyous experience. And what James has created is a way for you to tell that system which one of those you had. It might then be a relationship you've had for 30 years. It might be your general practitioner. It might be your optician or your dentist. And that's a long-standing relationship. And you want to either celebrate that relationship in some way, or you want to suggest that, well, maybe that Tuesday morning, Frank wasn't at his best. And I would like to let Frank and the team know that maybe he could have done something a little bit different or whatever. And I think this has created that it's not perfect. It doesn't deal with every single transaction in the Scottish Health Service, but it gives us enough information to be able to make change.